Hi everyone. So my name is Dr. Aman Tawheed. I'm also a Dow graduate like Dr. Bhatti. So we have a joint venture. This is my husband. I am the medical side of the idea and he is the IT person. So I would like to ask everyone in this room, if I can get everyone's attention, do you know or do you have a personal contact with a person with intellectual and developmental disability, like autism, Down syndrome, any kind of brain developmental issue? So look, it's like a lot of people. So if we look at the statistics, it's 7.38 million people in America who have IDD. Our idea is to empower the families. The only program we have right now is the WHO offers these training for families of people who have autism from ages 2 to 9. It's just a skill, how to take care of these individuals. It's a skill training program, but there is no health issue discussed ever. No medical training of any family or the caregiver of these individuals. So we have like a variety of IDDs. There's Down syndrome, Fragile X syndrome, Rett syndrome, fetal alcohol syndrome. If I start, I can go on and on till the evening. So it's not just a problem for kids with autism. It's broader than that. What happens to these individuals when they grow up? So I met my very close friend, a neurologist. No offense to any neurologist, I love you all, I'm a doctor myself. However, being a board certified neurologist, I was attending a conference in New Orleans, and she asked me, what brought you here? I said, I'm attending a conference for people with intellectual and developmental disability. She said, okay, so kids? I said, no, these are adults after 21. She said, oh, do they exist? So that's the gravity of the issue. People don't realize what happens to these kids after the age of 21. No provider is available to treat them for developmental adult medicine. I know so many. I work for a clinic for people with these conditions. No primary care provider. They're still going to their most of them are still going to their pediatrician. So if you understand what I'm trying to explain is, if the doctors have so much less knowledge about this field, how much would the family know? And they end up depending on caregivers trained by the federal government or the county. So if we talk about Maryland, it's called the Developmental Disability Administration, DDA. They provide services to these people, Medicaid and Medicare. They provide the caregivers, which are called the direct support professionals. They have minimal, they're like high school graduates, minimal to no understanding of hypertension, diabetes, any kind of diseases. So our goal is to create, we have this software program to train the families on 12 1-hour-long training sessions, 6 group sessions, and also workshops. So this is not just for people living in the US. The scalability is, because this is online course, it can be done worldwide. So this program will not only treat these people, they will not develop these chronic diseases that they have. Higher rates, more than people without IDD, they develop diabetes, hypertension, any kind of chronic disease. Higher rates of dementia, higher rates of mental health issues. Everything in these individuals is confused as a behavioral problem, rather than, understanding that it could be a medical issue, a dental issue, which they cannot explain it to you. So we want to empower the families after training them, and then less dependency on caregivers. So that is also a benefit, and then less dependency on the healthcare delivery system, because they will be able to manage them themselves. So I'm going to give it to my partner from here.
You have 1 minute. I sent a updated deck, but this is a little bit older deck, but anyway. So the market opportunity is 174.77 billion for medical training. Early and disabled services industry is growing at 0.6% per year. And families spend $335 billion worth of caregiving annually for their loved ones. So this is a huge market and untapped. It's a blue ocean. The unfortunate part is people don't even think that these people will live more than 18 years of age. So this is untapped, but there are adults around us who have autism and all these mental issues. Our go-to market strategy is using our current patient portfolio, using our healthcare facilities. We are reaching out to CTOs, CEOs, VPs, and medical directors for all these sales. We have built excellent partnerships with several large provider networks. I'm going to talk about it. We have 8 customers. We have executed 2 proof of concepts. Our current ARR is 100K for the last year. This is going to be 300K this year. We have received support from parents. We have received support from other larger medical providers who think there's a large value. There are not enough DSPs, direct support professionals in the market who can service. People don't want to come into this because adults are difficult to be handled. These are our sponsors.
Just a couple of questions to wrap it up.
Thank you, Dr. Tauheed. Great presentation. Just a question for you. I think you brought up an important point with the Medicare example that, this is offered and it's the quality of what you get is probably not all that great. The trade-off is, of course, that somebody else is paying for it. So one of the questions that I have is in your service, which I think addresses an absolute need of involving the family and training them on how to care for their loved ones who are going through things that you mentioned. But who's paying you? And along those same lines, how are you protecting the effort that you're putting in so that if somebody goes through it once, they're not just disseminating it amongst everyone they know in their communities?
So every state except Florida has associations. In Maryland, for example, it's called DDA. And they have the money to support all this activity. Families do not know how to get to those funds. Insurance also takes care of this, support long-term facilities. So, but the parents have to deal with this when we support directly, like how to get the money from the state. Except Florida, every other state has money. And we have interacted, we have helped parents, families to get that funding.
And how would you protect your product not to be just copyright pirated and sold?
Nobody's doing it right now.
Okay.
Nobody's doing it. I mean, this idea.
Any other urgent questions we need to ask?
We also have filed an SBIR and we have a provisional patent on this. But
how do you educate people about your program and to come to it?
We have a training full module. It's an online digital platform.
No, how do you get the word out?
So we are attending conferences. We are going to different partner networks. These are some of our partners that we have built so far. And we have already talked to them. They are across the country. We have reached out to the state agencies, and they are helping the word out for us.
And quickly, how much are you raising and what valuation?
So I'm raising 500K with a 4% $4 million valuation, which has been independently verified. And we are giving 12% of the equity.
Thank you.
That's it. Oh yeah.
Thank you.